name's Alyssa. I'm a student TA at Penn State Hazleton. Is it okay if I work with you today?
Yes.
And can you verify your name and date of birth?
Yeah. Captain Valley, 9/29/2005.
Perfect. Do you know where you are at today?
Penn State Hazleton.
And what day of the week is it?
It's Monday.
Perfect. So today we're going to be doing some exercises and transfers to help you with mobility and get you as independent as possible.
Okay.
Because I see you have had a C6 level spinal cord injury. So that means you don't have elbow extension, wrist flexion, or any of those finger movements. So we just want to work around that and show you activities that you can gain strength in those areas that you are able to.
Okay.
So with that, do you have any pain anywhere in your body right now? 0 being no pain, 10 being the worst pain?
Maybe just a 1.
A 1? Okay. Are there any activities within those like shoulder and neck movements that you feel you're not able to do as well as before?
Just kind of reaching, moving around in general.
Okay. And would that be a goal to gain strength in those areas?
Oh, for sure, yeah.
Okay. Very good. I see that you also have diabetes and you're taking Jardiance, so you might have some confusion during this. I just want to make you aware.
Yep.
Also, what you can expect from this treatment, you might feel fatigued because this is a lot of work. We're going to be doing high intensity strengthening exercises, which means you could also have some delayed onset muscle soreness.
Okay.
So that means soreness after 24 hours after our exercises. That's normal, but if it exceeds like 2 days, I want you to tell me so we can maybe lower the weight for those exercises. You may also have a loss of balance, so I just want to put this gait belt on you for your and my safety.
Okay.
So if you could use your elbows just to scoot forward over, so I can put this on you. Very good. We're also going to be doing goniometry of your right neck lateral flexion. So I'm going to be doing that a while. So that motion, you're going to be trying to reach your right ear to your right shoulder without moving your shoulder, just like that.
Okay.
Good. And a normal range for that would be 45. Okay, whenever you're ready, you can go ahead and do that motion. Okay, and you got about 44, which is normal because normal is 45. Okay. Before we get started, I want to make sure that all of these bony landmarks, your skin is intact. See, your elbows are good. If you could lean forward using your elbows. Good, your scapulas are good. Could you weight shift towards your right side for me? Okay, I can see that your ischiotuberosity is good on that side and on this side. Very good. Behind your knees looks good, and your feet. I would make sure that I could see the skin for those. Speaking of checking the skin, I want you to check your own skin when you're at home or in the rehab facility, wherever you're at. I want you to do that on your own every morning and night for those areas that you don't have the sensation in, because those are areas that could cause some ulcers or pain. Also, since you are in the wheelchair most of your time, I want you to weight shift every 15 minutes, like you just did for me to check your skin, and I want you to hold those positions for 2 minutes.
Okay.
Also, when you are laying in bed, I want you to change positions about every 2 hours if you can, to also prevent those injuries. Okay, so now we can move on to our transfer with this sliding board, and we will also be doing our exercises. Once once we transfer. So first I'm gonna take this off so that it doesn't get in the way. Just put this over here. I'm also going to remove the footrests off to the side. I'm going to move the chair so we can just get it more out of the way. I'm locking the wheelchair again. Very good. For this transfer, we are going to be using this sliding board,
Okay.
and we're going to do this transfer in 3 movements.
Okay.
Okay, so first, can you weight shift onto your left side so I can squeeze this underneath? Perfect. Now, since you don't have elbow extension, I'm going to want you to use that right elbow and push up.
Okay.
To be able to slide and end up seated right here.
Okay.
Okay. So I want you to lean on my right shoulder and then use that elbow. 1, 2, 3. Okay. And you can sit up like this. And I'm going to move the sliding board out of the way. Okay, now if you can lean onto your left side, and I will move your legs up onto the table once you're there. Very good. And then onto your stomach. Okay. So we're going to try to get you into prone position. So the best way to do this, you're going to move onto your right side, but I'm going to get on the other side for safety. Okay. So we're going to be using momentum, so I'm going to want you to move your arms, and I'm going to cross this leg over this one just to make it easier, and I'll help you. Very good. Now that you're on your side, you can use momentum again, roll onto your stomach. Good. And you can get up onto your elbows. Good. So you're in that prone on elbows position, which is helping with your flexor tone at your hips. Now while we're here, we're going to be doing some exercises. The first exercise, you're going to be walking on your elbows,
Okay.
left and right. First, if you could scoot a little bit towards the middle of the table. Good, and I'll move your legs. That's good right there. Okay. So, similar to what you just did, I'm gonna have you scoot to the left and right. Yep, just like that. We'll do 3 sets of 10. Good. Okay, we'll say you did 3 sets of 10 of those. And now we're going to do some scapular protraction and retraction, which is squeezing your shoulder blades together and then apart with this weight. Very good. We'll do 3 sets of 10 of that as well. Do you have any pain with that?
No.
Okay, does that feel difficult?
Yeah.
Okay, good. We'll say that was 3 sets of 10. You're all done. So now I'm going to get to the other side. So you can use momentum once again. I'm gonna move your leg and we're gonna roll towards me. Very good. And then onto your back. Good. Now I'm going to just move your legs off the table a little bit. And if you can use your elbows as best you can to push up into a sitting position. Very good. Could you use your elbow again? Just scoot one more time closer that way. Very good. Now I'm using this sliding board again. If you can weight shift to your right. So I can squeeze that under. Very good. Now we're going to do the same thing that we did to get onto the mat table in 3 movements. So try to use that elbow. Very good. I'm going to take this off and put this back on. Very good. I'm going to move the footrests back. That's locked. I'm just going to move the chair a little bit so I can get that other footrest back on. Very good. How are you feeling?
Not too bad.
Okay. Now I'm going to check your skin again like I did in the beginning. You can lean forward. Good. Your scapulas are good. I see your elbows are good. Behind your knees. Your feet. You can weight shift to your right side. So I can see your ischial tuberosity. Good. And then the other side. Very good. I'm also going to be doing passive range of motion to keep all of those muscles and joints loose.
Okay.
So we're going to do some at your hip and knee. And then at your ankle. Good. Now at your elbow, wrist, and your elbow, wrist on this side. And can you show me that active range of motion that we tested before with your neck? Very good. Now for your at-home exercise program, I'm going to want you to do those same exercises that we did here,
Okay.
but on your bed at home or the rehab facility.
Okay.
Do you have a weight like that you can use?
Yeah.
Very good. So I want you to use the same amount of weight. You're going to do 3 sets of 10 for each of those exercises, and
Okay.
I want you to do that twice a day,
Okay.
but every other day.
Got it.
Okay? Okay, do you have any questions for me?
I don't believe so.
Okay, thank you for letting me work with you.